Welcome to Elevate. I'm Rachel and this is Nickie.
Hi, Rachel.
We're here to bring you the best insights from local wellness experts, helping you elevate your health one simple step at a time.
Don't forget to sign up for our newsletter for curated wellness tips. You can watch this episode on YouTube or Spotify or listen on Apple Podcast at Elevate Wellness.
On this episode of Elevate.
Just because that's the normal, it doesn't mean that's what has to be accepted. Right? It's very common to hear women say that. It's normal for women to say, oh, just leaking, it's just part of getting older. But it doesn't mean you have to live that way. You don't have to accept it. There are solutions. There are people here that can be part of your community to help you.
This week on Elevate, we welcome Dr. Sara Salander, a women's health and orthopedic physical therapist and the owner of Balanced Physical Therapy and Wellness in Myrtle Beach. In our conversation, Dr. Selander sheds light on the often overlooked importance of C-section recovery, discussing scar mobility, deep core activation, and proper body mechanics in everyday life. She emphasizes the need for individualized recovery programs that address the unique challenges faced by postpartum mothers. Dr. Selander specializes in helping active women, especially moms, feel strong, confident, and capable in their bodies again. Her whole person approach blends physical therapy with education, strength training, dry needling, and lifestyle guidance to help women return to their activities that they love without pain, fear, or limitations. She focuses on rebuilding the core and pelvic floor to support real life, from lifting kids to training for a race. Passionate about empowering women with simple, effective strategies, Sara's mission is clear: to help women feel at home in their bodies again.
Sara, welcome to Elevate. We are so excited to have you.
Thank you.
Yes, this is quite the treat. You have an interesting perspective that we've not been able to share with our audience yet. So we're really excited to have you as our guest.
Awesome. I'm happy to share.
Yes, we're going to be talking everything from core and pelvic health to how not to allow those small aches and pains to get out of control and be an interruption to our day. But before we get into all of the good stuff, why don't we just start with what drew you to focus on women's health and why rebuilding the core and pelvic floor in the right way is so important to just our day-to-day living?
Sure. So I was hoping you'd ask that question because I had to pull out the calculator and do the math, but I've been practicing now for 17 years as a physical therapist. And my background was in orthopedics and sports medicine. But then I started having my own children and just realizing the lack of education and guidance that I was receiving as a pregnant mommy, and then through my postpartum journey, and then a C-section healing. And of course, what do we do when we want to learn and heal ourselves? We start learning, right? So that's kind of where it all started, 5-6 years ago, and just realizing the lack of education for myself, what my providers were able to tell me, because I was very active through my pregnancies and wanted to get back to that myself. And so that allowed me, or kind of encouraged me, to start diving deeper, taking more continuing education, and just realizing every mom really felt that way. Every mom wanted to feel like themselves again, to feel stronger. And because they wanted to take care of themselves and their family, right? They didn't want to have back pain when they were standing in the kitchen cooking dinner, or shoulder pain when they to reach their baby out of the crib, or knee pain when they went to the gym because that was their social outlet for the day. So just kind of all of those things guided me into women's health and really helping pregnant and postpartum mommies, and now as I'm going through new seasons of life, that's kind of expanding and helping women through perimenopause and menopause and how our body changes across our lifespan, and how I have a perspective as a female in helping other women feel their best from the inside out.
That's beautiful. And I was sitting here thinking, as you were talking about changes in life, if we start early with the treatment, the procedures, the information to help our bodies early on, especially after pregnancy, and we continue with that, what a better way to live life than that, to be healthier early on. The healing process that it takes after a pregnancy, especially, and then beyond as you are caring for your children, and then as your body changes. That's powerful and much needed. So tell us how you do all of that.
Yes. So, I focus a lot on prevention. I spend so much time on education because what you learn with me, those are your tools. You get to keep them forever. And that is the power of what I get to do as a one-on-one provider, meaning I see my clients for an hour. one-on-one. It's very personalized. It's a concierge experience. We do a lot of education. I do hands-on care through massage, cupping, dry needling, and then we do targeted exercise and movement. And always working towards, what are your goals? What are your short-term goals? But what does that like long-term health look like? What is that dream? What if I could wave the magic wand? What could I help you get to that maybe you thought wasn't even possible because you've been told this is just part of being a mom. This is just part of getting older. And you're not okay with that. You don't want to live that way.
So true that we hear that so often. It's just part of being a woman, part of being a mom, part of that. It's just part of getting older. But inherently, that doesn't really sound true. It doesn't seem right because as a mom, especially, you carry a lot of weight. Literally, the weight of thinking for another person or many children. You're no longer just thinking for yourself and standing in the kitchen with aches and pain. When you don't physically feel strong, you don't mentally feel strong for the family and to support the family either.
Yeah. And the more I talk to women, as I've isolated more into women's healthcare, we are so selfless. We're always thinking, I need to show up for me so I can show up for my family. That's what every mom is telling me, right? Maybe the aches and pains are a little different, but it's ultimately that they want to show up and be the best mom they can be, provide for their family.
Yeah.
How is it that you actually help women understand that there are solutions to what you're going through? I think that we are sort of just taught to feel like you just have to deal with it. You just have to press forward, taking a leave and move forward. There really aren't true solutions to some of the issues that we face with our pelvic floor, with the aches and pains, with the joints. I'm in a different season of my life than you ladies are, and I feel different things. So how is it that you're able to actually help them? Like, give me an example of someone who comes in who's just had a baby and is looking to say, this I'm in pain, or I don't feel good. This isn't normal. And what do you do? Like maybe with the pelvic floor or after a C-section?
Sure. So the C-section example is pretty easy, and most women can relate to that. So usually when I have a new mom come in from a C-section scar, they're like, I've never touched that thing. I can't even look at it. There's no way I've done anything. And so when I go to, once we start getting into the examination part and I look at their tummy and their scar tissue, it's very bound down. It's very tight. They're scared to touch it. And so we just start with that gentle touch, that empowering education. You can touch your scar. You want to touch your scar. Fun fact is right under your C-section scar is your bladder. So if your scar is not mobilized and moving, that scar tissue can actually impact your bladder, which can lead to bladder dysfunction. If that C-section scar isn't moving well, your deep core muscles aren't going to fire and work correctly for you, meaning low back pain when you're standing in the kitchen or when you bend over the crib to pick up your baby. So we start looking at how all these things, how your muscles, your joints, your scar tissue, how it's all interacting and communicating with each other. And then we develop a very individualized program. So for that C-section mom, it would be, okay, we're going to start working on our C-section scar mobility. Maybe when you're in the shower, you're going to just start rubbing that scar tissue gently with soapy water, start getting things moving. We're going to start using your breath work and gentle pelvic movements to start getting those deep core muscles firing again. And then we're going to talk about your body mechanics. So how do you lean over the crib to pick up your baby? Or how do you stand in the kitchen when you're cooking dinner with a baby on your hip? And we start talking through all those pieces, very real life stuff. But once you have the tools and the knowledge, you're like, oh, it's not hard. You've just never been taught. And so every session we kind of build and we progress, right? So when they come back for that third, fourth, and fifth session, we're getting harder exercises. We're talking about the type of movement they want to return to. Maybe it's yoga, maybe it's CrossFit, maybe it's running. So everything is highly tailored to their specific goals and return to fitness and
That's
return
golden.
to work.
Yeah, that's golden to have that specific of care for your individual needs. I mean,
Right.
really, I feel like that's the way medicine needs to
Should
be
be.
going and should be, right?
Should be. And we're talking so much more about prevention, right? Let's be proactive now and prevent all that stuff down the road from happening. And you just have to find the right person the right person to have in your corner to help guide you through your journey.
I think there were a lot of aha moments for the women that were listening when you said that your bladder control can be affected by your scar tissue. Well,
I didn't know that.
For a minute, right?
I didn't have a C-section, but I'm thinking, well, gosh, that made total sense. Why didn't someone share that? Why are we now at this stage in our lives that someone's finally saying, hey, this is the thing? Thank you, Sara.
Yeah, right. And our pelvic floor health is impacted even as we go through perimenopause and menopause because our vaginal tissue changes, our strength in our pelvic floor. Those are really, your pelvic floor is a group of muscles. It's like a hammock. It sits at the base of your pelvis. And just like every other muscle and joint in your body's impacted through your estrogen, as we transition through perimenopause and menopause, your pelvic floor, it doesn't get spared. It's there too. So some women will notice increased leaking or laxity or pelvic pain. And it's often because those muscles, we need to kind of give them a tune up. We need to remind them to come to the party. And we need to support them just like we do the rest of the muscles and joints in our body.
And it sounds like there's more than just do Kegels. There's more
Absolutely.
that you offer. There's more to consider. Like you had alluded to, the scar tissue.
Yeah. So your pelvic floor is intimately connected with your deep core muscles. That's your belly muscles, the muscles around your hips, the muscles in your legs, your breathing. So what's going on in your rib cage with your diaphragm. Everything needs to work in harmony and in coordination. So a lot of what I do with pelvic floor health is external work, meaning I don't do any internal examination and release, but we're talking about how do you move daily and how can you optimize that movement so everything works in harmony and prevent the leaking, prevent the pain.
What are some of the exercises that we should be doing to help with that?
Yeah, I was just thinking the same thing. So when people come and see you beyond, the Kegels and the pelvic tilts and everything like that, it sounds as though you give them not only core strength, but leg exercises to strengthen their legs, like squats, or what does that look like?
So let's say, example of a lot of women say, oh, if I have to squat to pick up something heavy, I'm going to leak.
I'm not laughing, but gosh, it just sounds relatable sometimes, right?
So we're going to talk about your pelvic floor. Again, these are a group of muscles, right? A muscle needs to elongate and a muscle needs to shorten. And they need to do that in the right timing and syncing. So we're going to talk through in our session is when you go to squat and pick up that heavy object, we might inhale as we sit into our squat, which is going to let our pelvic floor lengthen and get long. And then we're going to start our exhale and pick up that heavy object and kind of build this bottom up pressure. So your pelvic floor is engaging. And when you take that pressure from the top, from the lift, these two forces are in harmony with each other. And that's what prevents the leaking when we go to squat and pick up something heavy.
Hi, friends. Without our sponsors, we wouldn't be able to bring you Elevate, your local resource for connecting with our local wellness experts. Plus, our sponsors are offering amazing offers to our listeners. If you've been interested about the science and healing power of red light therapy, this is your sign to try it for yourself. At Laser Lab, they specialize in helping your body do what it's designed to do: heal, store, and recover naturally using the power of light. Whether you're dealing with chronic pain, slow recovery, inflammation, or just low energy, this therapy helps you feel better from the inside out. And right now, for our podcast listeners only, Laser Lab is offering an exclusive Experience the Light consultation. Your first session is free when you mention Elevate or use the code PODLIGHT at booking. It's your chance to see what red light therapy can do for your recovery, your energy, and your health. Go to our show notes and book your visit today at laserlab.com/podcast or stop by Laser Lab and tell them you heard about them from Elevate.
So we're talking a lot about, it's bringing a lot of mindful movement. It is normally an automatic reaction, and we want it to eventually be automatic. But when we're having an issue, we might have to bring some more mindful intention to it to retrain our body and how it moves. So that would be an example of like leaking when you lift. That would be something we would talk through. We would physically be doing it in here. We'd be talking about how your breath, how to sync your movement, what muscles to fire up and engage, so everything is working together and showing up at the right time.
We talk a lot about breath work, and this is another example of
Yes,
how it
huge.
plays such an important role in our health and our healing,
Yes,
and in the prevention.
Mhm.
yes,
Mhm. Yeah.
100%.
And it makes us feel stronger. What
Yes.
are some of the simple ways that you feel you're able to give like active, because you really serve the active woman and the mom, postpartum mom, to get ahead of any of the pain that they might end up having that could inhibit their movement?
How do I encourage them to get ahead of it?
Yeah, that preventative side of it.
Yeah. Well, the first thing I think I often tell women is just start keeping a little journal and note for yourself, because I think we're scared to ask for help, or we're scared to even say there's a problem. And a lot of the young moms I know probably don't have a primary care provider. They often are using their OBGYN as their primary health provider, and maybe they don't see them but once a year, or when another pregnancy happens, or only at that 6-week postpartum checkup. So the first thing I tell people is like, be the advocate for yourself, right?
Mhm.
If you feel like something is wrong, if you feel like your body's not showing up for you, start making notes. The more notes you can provide for me and kind of tell me, this is what I'm feeling, this is where it impacts me in my day, that's just more knowledge I can do to build a program that's really going to help you. And again, I think that goes back to the education. It's just letting women know, I hear you and you're not alone in this, and we can work towards this goal together, whether it's improving your shoulder pain or your low back pain or the leaking.
We've heard
I
that
know.
often, Nikki. Yeah, like
I
start
was thinking,
tracking.
I was thinking too, as you were speaking, this is what you say, bounce back culture versus real recovery.
Right.
Anytime we have gone through a situation, whether it's childbirth or just the changes in life, just bounce back. You'll be okay. But really, we've got to start changing the mindset that it's time to really recover and
Mm-hmm.
flourish moving forward. And that's the difference, is what you're doing. You want to
Right.
flourish. We're all going to go through aches and pains and changes, but how do you really recover and flourish and not just exist? Because I think a lot of women just say, oh, it's just part of it.
Right.
And we've got to help people, and women especially, say, it's not true. That's not the way it should be.
Right. Just because that's the normal, it doesn't mean that's what has to be accepted. Right. It's very common to hear women say that. It's normal for women to say, oh, just leaking, it's just part of getting older. But it doesn't mean you have to live that way. You don't have to accept it. There are
Mm-hmm.
solutions. There are people here that can be part of your community to help you.
How
Yeah,
does the dry needling fit into that? Oh, I'm sorry. I'm so
no, I
intrigued
was
by
kind of
dry
going to go to that
needling.
too. I was thinking about
Sure.
the modalities that you had mentioned. The
Sure. So
cupping,
the
the
dry
dry
needling,
needling.
I use a lot of dry needling as one of my pain management tools. So let's just say, as example, I have several like yogis who maybe have low back pain, or CrossFit athletes who have low back pain. And we do a lot of the exercise and the stretching. So they have those things they can be working on between our sessions. But then within the sessions with me, I like to do a lot of hands-on work to really work on the pain management piece. Dry needling, we use tiny little single-use needles, and we go directly into the muscle belly with the goal to kind of release tension or release trigger points. You might have heard that word before, to help with pain regulation. But the type of dry needling I did, also, we have healing points in our body that are well researched through acupuncture and dry needling. And I also utilize some of these healing points that maybe are away from, let's say, your low back, but that promote your system as a whole for healing. So again, just you can go anywhere and just like get out of pain. But we're talking about, how do we heal our system from the inside out? How do we move to that preventative care, wellness, long-term well. And I think dry needling is another tool in my toolbox that my clients really enjoy and see a lot of positive outcomes from.
Is that different from acupuncture? How is it different from acupuncture?
Yes. So acupuncture and dry needling, they use the same needles, but just kind of the reasoning is why you're going, where you're going is different. So acupuncture is based off Chinese medicine. You're healing your yin, your yang, your energy fields, versus dry needling is based off more of our medicine of, this is the muscle. This is where the muscle is located. These are the nerves that leave your spine and innervate or activate those muscles. These are known healing points throughout your system that help activate your parasympathetic nervous system, which is your rest and relaxation system, to kind of get you out of fight and flight, to get you out of that panic mode. So it's just really the reasoning as where we're going is different, but it is the same needles that are used.
Yeah, that's interesting how we look at those differently for, different outcomes, but equally beneficial. And what about the cupping? I have not had that done nor seen it done before.
Again, just another tool in the toolbox. I find a lot of people find relief, especially with like shoulder and back pain. I do the cupping, and that's kind of over the tight muscle, over the trigger point. And then a lot of times we'll leave it there as like kind of a static hold. You can use a static hold on them. You can incorporate them with a little bit of like active movement. So let's say a lot of women, we sit at computers all day, we carry stress in our shoulders. I'll put them kind of up here across your shoulder muscles and down the center of your spine. So where we carry all that tension and stress, those cups are on with some gentle shoulder up and down, maybe some shoulder rolls, and you just you feel the pressure of the cups as you're moving. But then when you take the cups off, you kind of feel that elongation, that relaxation of the muscle. And that's what we're going for.
I would assume the audience knows what cupping is, but just explain how it's actually kind of like a rubber plastic ball that sucks in the tissue. Can you explain it a little bit more in detail what it is?
It's like you did a great job.
Oh,
It's a
good.
plastic cup, and we put it on the skin, and then we kind of use a little pump, and you'll feel your skin kind of lifting up into the cup, and you'll feel a lot of that compression in that area. And we're doing that over a tight spot with the thought we're going to build up that tension, and then when we release the cup, we're going to let that tension go. And it's also a great tool to use over your C-section scar, just since we've talked about that already. Using like a silicone cup over your C-section scar in the soapy warm water, and just again another way to self-mobilize that scar tissue over any scar. Really doesn't have to just be C-section.
It's so interesting that these modalities are in some ways very basic. They've been around for a long time, but they have such healing powers that we are just now more universally accepting it as a way to heal. And we've just missed the mark, I think, for so many years trying to heal ourselves with a pill, with a solution, when really, it really just goes back to a lot of times some of the basics. And when you described lifting the skin and the muscle, I already felt better just listening to you describe it. So I can only imagine how it feels for your patients to come in and get the relief that they need, knowing we all stay in fight or flight a lot. We all stay with our shoulders to our ears a lot. We need to learn how to decompress. And if we can do it in such a natural way, why aren't we doing it? Right?
Right. And, this might be sagging away, and if it is, just wave me down. But that's kind of, I stepped away from our traditional healthcare model, which is a very reactive system. And I am doing what's kind of an out-of-network provider, meaning I develop a relationship with my client. We build a plan that's not dictated by what insurance says we can do, but what we feel like we need to do in our plan to get you where you want to be. And being as a one-on-one kind of concierge provider, I feel like I can really offer my clients so much more, and I can really follow them through their seasons of life and be a part of their wellness team. Like I want to be a part of your team for as long as you'll have me, not just like, I just want to see you for 4 visits and get me out of this shoulder pain. I'm looking to help you heal and optimize your function across your lifespan.
There's a lot to be said with that, Sara, because I don't know of a physical therapy practice that isn't kind of tied down by insurance. And that's a whole other conversation, but I think just generally speaking, it dictates not only the modalities that you can provide the patient, how long you can see the patient, and quite honestly, exactly what you can treat them for. Because, if they have back pain, but you start working at a different part of the body, because that's really where the source is, insurance is going to say, well, they're not here for that. Right. So I think that it's amazing that you're offering this service, because I've always believed, and yes, I'm a bit partial with my physical therapy background, but physical therapy is one of the closest things to just holistic as we can be in our Western medicine. It really, you build such rapport with your patients, you spend time with them, and you get to know them, and you work on the tiniest little muscles, right, to balance everything else out. And then those modalities, like you shared, are just tools in the toolbox to help continue what you're already working on achieving for them. So I think that is wonderful that you are providing that service to our community. It allows you to really step into what you want to be able to do for people without being hindered.
Correct. Right.
Yeah.
It removes a lot of the restraints that I felt as a provider previously when I was like, I really want to do this for somebody, but I literally just can't. I'm not allowed to, even though I think it would benefit you. And that just circled right back into the education. So much of me starting out as really the only out of network concierge provider in the Myrtle Beach area is I'm having to educate people to really make them reset the framework of like, you don't have to just see me when you're in pain. Like we can start working together now while you're pregnant. So you have a better delivery. So you have a better postpartum healing. So when you get pregnant again, you're ready. And those are just examples, but just kind of getting in people's mindset, like I said, is just totally changing the way we've always thought of utilizing physical therapists and utilizing our healthcare.
Yeah. A lot of times I think, the general population looks at physical therapy like, oh, they're just going to work on my knee, just on my shoulder. But taking everything that and making it a holistic approach, using physical therapy as the tool and foundation that's beautiful. I love it.
What has been the most rewarding experience for you since you have taken this new approach to your practice? I imagine that you have to have some stories, some outcomes that have just really moved you in your practice.
Yes. I mean, I think it's such because I'm a mom. It's like the stuff that pulls on my heartstrings. Like it was a young grandma who was like, I have a new grandbaby and I want to go see them, but I have knee pain. And so like, I'm scared to pick up my grandbaby and walk them up the stairs because what if my knee gave out? What if I dropped the baby? Just like, and you're the grandma, and it's just simple things like that. And then they call me like, oh my gosh, I carried the grandbaby up the stairs and I felt strong and I knew what to do and I felt safe and just how empowered they felt. And there's so many stories of women just calling me and saying they just feel so much powerful, more at ease. They know what to do. And even if they have a little setback, they know when to like dive back into their exercises and kind of pick them back up and get feeling good again, get feeling better. So there's so many stories like that, but I think it really goes back to just feeling empowered in your body and feeling like you're doing what you want to do, even if it's the simplest thing like picking up your new grandbaby and carrying them up the stairs safely.
Hi, friends. Have you heard about Ayurveda? It's the 5,000-year-old system of holistic medicine that brings your mind, body, and spirit into balance. Through personalized nutrition, herbal remedies, daily rituals, which I love, and gentle detox practices, Ayurveda helps you restore harmony and lasting vitality naturally. That just sounds good. We're so grateful for our local wellness expert and sponsor, Kerry from the Holistic Highway, a globally recognized leader in integrative medicine and Ayurveda. Kerry is transforming modern health by focusing on you, not just your symptoms. Through her personalized system that blends nutrition, lifestyle, and genetics, she's helping clients find lasting balance and vitality. The Holistic Highway provides a personalized system to manage chronic disorders by incorporating fundamental changes in diet, behavior, and stress while focusing on genetics. This individualized program is so successful that many of her clients have achieved maximum healing and vitality after years of chronic problems. Because there is no one size fits all in health, Elevate listeners enjoy a complimentary 30-minute consultation to discover your unique mind-body type and one actionable tip for better balance. So book through our show notes and mention Elevate to claim your offer.
Let's give a big thank you to one of our amazing Elevate sponsors, Brain Performance Training, led by local wellness expert Laurie Sampolo. After more than 20 years as a registered nurse, Laurie witnessed how addiction, anxiety, and PTSD impact families, including her own. That experience inspired her to offer neurotherapy as a holistic, science-backed way to help people take control of their mental health. At Brain Performance Training, the mission is simple: break the stigma, and encourage everyone to seek the support they deserve. Healing begins when we reach out, and Laurie is here to guide that journey. Mention Elevate and receive 10% off a treatment package, including before and after EEG and 15 sessions. Contact Brain Performance Training at gmail.com or call 843-655-3325 to learn more.
Yeah. Feeling
That's
strong
beautiful.
allows you to be a part of your family in another way, and being present.
Yes.
You provide a 10-minute readiness check, and you are going to provide that for our listeners. Can you
Yes.
tell us a little bit about that?
Yeah. So what I, again, thought it would help is maybe you kind of trigger you if you kind of look through that. This is kind of like just read through the little survey and think, oh yeah, I didn't even think about that. That's a little problem. Ooh, I'd like to feel better there. And just maybe trigger your brain to think through some things of how physical therapy can really help you. And so then you're going to go through those little questions, and then it kind of puts you in a box of like, oh, I'm doing really good, or oh, I have some room to improve. And no matter which box you're in, even if you're in the box, I'm doing pretty good, I work with so many women who want me as more of like a wellness part of their team provider. Like, I know I'm training for this marathon next year, and I just want to make sure nothing comes up. So we're going to start working together monthly, every other month, just to address any aches and pains that pop up. I see clients that way. And then I have another bucket of clients who are like, yes, I know I have back pain and I'm leaking and I need to do X, Y, and Z. And we're working that way with some pain points, some known pain points. So hopefully by taking a little survey, it'll just get you thinking about the ways in which I can support you, your body, and your healing. And then if you feel like you want to work together, it just kind of gets us just started thinking about where a good starting point is and where you might want to progress to.
Seems simple enough. Like we can just, it's a little page, right? It's a one pager. We can just go right through. Perfect.
Yep. And then I think all my contact info is on there, and we can set up a little phone. I always start my sessions with like a 10-minute phone consultation. It's always included because I want to make sure I'm the right provider for you. And if I'm not, I want to guide you to that provider. So it's a great start. And then we are making sure we're all on the same page together.
I suspect just the questions in general would help us to see things that we probably didn't even realize we were dealing with until we take the survey, because we're discounting so often times the things that we are feeling, whether it's, my neck is kind of hurting, but I'll feel better tomorrow, when really that's something that we could address and resolve that and have lifelong healing and feel better, rather than just discounting it. Because I think as women, sometimes too often we just discount how we feel and think, it's just we just got to keep pressing forward. But a survey would really make us mindful of what's going on with our bodies, if we'll answer it truthfully, right?
Yes. Yes. Yeah. And just even, I think there's so much power in thinking, if I could wave that magic wand and get you somewhere you never dreamed of, to take that dream trip, to run that race, right? To try this new movement, exercise routine that you've been so scared or hesitant to do. There's power in that. And maybe you've never even allowed yourself to think that far, but with the right team, we can get you there. We can have you reaching those goals you never thought possible.
Sara, we need you on our team.
Yes, I'd love to be a part.
And I love that you span all seasons too. Preventative, going into something feeling strong. For those that knowingly need you, there's something that feels off, to those that going into different seasons like perimenopause, as well as those that feel great and they're wanting to just level up, right? I love that you see the entire span of women in whatever season that they're in. And it also makes me think too, is often we just peg hole ourselves into doing a certain exercise, whatever the new fad is, or running hard and lifting heavy. And that might be great for some people, but it's not great for every person. And so take time with yourself and, get back to your core, right?
Get back to the foundation. So much of what I do is like just talking about where is the right entry point for you, right? Maybe you see in a group fitness class, they're all doing Lord knows what over there. And you're like, well, I can't do that. But again, we go back to those empowering tools, learning with me, where is the right safe entry point for my body to do these movements in a safe way that's going to help me progress without causing more injuries or more setbacks. And, that's where my knowledge as a physical therapist comes in, whether you're healing from an injury or returning to fitness after baby, or just wanting to level up, like you said.
I think though, if I was to guess, and you will tell me if I'm right or wrong, but really we have to have a strong core
Yes.
for everything moving forward.
Yes.
Is that correct?
Absolutely. Yes, it is the foundation, right? The core is the center of your body. It's the forces from your upper body, your lower body, all move through your core. So if your core is not functioning well, hello hip pain, back pain, shoulder pain, difficulty playing golf, difficulty walking on the beach.
And balance is so
Balance.
important too as you move
As we
forward in
age.
life, and that is really where you want to strengthen that core because it keeps you stable. And we know, as you talked about the grandmother, just moving forward with holding a grandbaby or just going up the stairs, all of those things, you have to have that strong core, and that is something that you totally help your patients with and
Yes.
focus on. Yes.
Yes.
And just listening to you too, Sarah. So after postpartum, I had, you're going to help me remember, I'm sure. Is it diastasis recti?
Yes. Yes.
Okay.
The abdominal separation.
Yes. And you're just told it'll be fine.
It'll get better.
Nothing that you can do about it. And so, I mean, mine isn't like drastic, but it's enough to where I notice it personally. But ever since then, I've always said my core doesn't feel very strong. And yet, I like to hold my planks. I like to do all sorts of things, but progressively my SI goes out or my back hurts. And so I'm thinking to myself, wow, how wonderful would it have been to see someone like yourself? I mean, just to even have a referral for my OB-GYN to say, hey, this is okay where you're at, but we want to set you up for success. Go see Sarah. Even now, take that readiness check. It makes you think, hey, maybe I could benefit a little bit. So my SI isn't always out or my hips aren't always aching because that's not normal as far as just getting older, right? There's a reason. It goes back to your core and your foundation. So it just made me think a little bit. But it would be wonderful. All of our listeners need to tell their OB-GYNs to start referring to Sarah at Balanced PT.
Yes. And I mean, unfortunately, it's, it's not the standard of healthcare in the United States. It is not the standard of care to be sent to physical therapy after vaginal or cesarean delivery. It's not. So you have to advocate for yourself.
Yes, we do.
And even if the good news here is another little, might be a little off the beaten path, but in South Carolina, we have something called direct access. You yourself, if you feel something is not right or you want this care, you can go directly to a physical therapist for up to 30 days in our state and work with that provider. It's really the insurance companies who are saying you have to see your doctor first. You have to have the note. You have to have pre-approval. But you're allowed to come directly to us and advocate for yourself and say, hey, something just doesn't seem right. Can you check? Can you give me some starting points? Like, where can I get going and start building this foundation? And then a lot of times once we work together, women are like, yeah, this is important to me. I want this, right? Whether or not insurance is covering it or not, or my doctor's covering it or not, like, this is important to me and I'm going to do it.
Okay, I totally did not know that. So thank you for sharing that with us because you are correct. We have to be our own best advocate because no one else is doing it for us. They're all just sending us down, the system road, and had no idea that we could have that access to a physical therapist on our own. So thank you for sharing that. That is a valuable piece of information there.
Yes. Yep.
Yeah. Wow.
Sarah, I
Lots
know
of
you're
light bulbs, right?
I know, lots of light bulbs.
And I want to keep you on just as our flow of conversation, is richer and richer. But I know you're in between patients. So what is one of the most important things that you want our community to know about Balanced PT?
I think just to know, I would love to be a part of your team. I have a passion for helping active, busy moms just like me, because I know sometimes we need to give each other a little grace. But I feel like I've been in your shoes. I myself want to stay active and healthy. I want to show up for my family, my career, my marriage. So I just want you to know, like, I'm here for you. And I would love to be a part of your wellness community and team and to reach out. If you just feel like anything doesn't feel quite right, we can always just do like a one-time visit, screen things, check off the boxes like this is good, 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 good. So you even just have that peace of mind knowing I can take the next steps. Or if we find something, knowing, hey, these are the next things we're going to do together to create solutions for you.
Knowledge is power, and that's what you
Oh,
are
yes.
able to deliver to your patients. That's
Yes.
so important.
Yes.
Can you tell everyone how to find you, Sara?
Sure. So I have a website, it's ptwellness.com. I'm pretty active on Instagram and Facebook. My handle there is at balanceptwellness. And then if you're ever ready to book a discovery phone call, you can just simply go to the website on the contact me page or email me at sarah@balanceptwellness.com. So I am a one-woman show. You'll usually get a hold of me. Just
We
please
love it.
give me some grace and patience to get back to you, but I do. I get back to you.
That's awesome. Rachel, this has been great, hasn't it?
Yes, it has been wonderful.
And do you have one last burning question?
Sara, what is the one thing that you would encourage women today to start doing to elevate their health and wellness journey? One simple, tangible step.
Yeah. Oh man, I feel like I'm going to say something. I listened to a recent podcast. And it was the breath work, and I really feel like I have to go back. We're so stressed and overwhelmed. Your breath, taking a deep 360-degree breath, inhaling, filling your belly and sides and back expand, and exhaling, feeling your belly, sides, and back kind of melt in. There's so much power. It's activating your deep core. It's activating your rest and relax system. It's helping you mindfully connect with your body. So it's something like that simple as just like laying on the floor, propping your feet up on the couch, and taking 5 to 10 good breaths to either restart your day or end your day, I think is so much power in your healing as a person, as a whole.
I agree. Breath work has really been a game changer for me. I've learned how to do it more through going to yoga, but also just implementing it in general. There's the box breathing, the four,
4 counts
and
in, 4. Yep.
And so there's just so much healing and power in breath work. So I agree. I love it.
It's an easy, free start. Yeah.
I think it's essential too to be able to do some of the other things like track your symptoms, right?
Yes.
Or just be conscientious of what's going on. If you just don't stop and breathe for a minute, then you're not going to be quite as aware of what's going on with your body.
Yes. I mean, when you come see me, I ask a lot of questions. So, for example, people are like, well, my shoulder hurts. And I'm like, well, where does it hurt? When does it hurt? What does it feel like? Is it burning? Is it achy? Is it stabbing? Is it sore? Is it pins and needles? Like, is it only when you lift your arm this way or you reach around that way? So the more we can mindfully connect with our bodies, even before you come into your provider's office, is just going to help you get so much more out of your session because you're going to be able to give us a lot clearer answers. And that way we're diving into the fun treatment stuff and intervention work a lot quicker.
Makes so much sense. I didn't even really think about when I say my neck hurts, all those things you just mentioned. It's just so much more than my neck hurts.
My neck hurts.
Yeah. So totally makes sense that you could be a game changer for so many women. So
thank you, Sara, for being here today. We enjoyed you.
Yes, thank you.
It's such a treat.
Hi, friends. Please leave us a 5-star review and let us know what you thought of today's episode. Share it with someone who needs a little inspiration and tell them why they should tune in to Elevate, your go-to resource for healthy living here in the Green Strand.
Each week, we're cultivating conversations that inspire well-being, support the ebb and flow of coastal living, and help elevate our community's wellness journey.
Don't forget to join our newsletter, a culinary garden of resources, including our downloadable Wellness Made Simple with curated tips from our local wellness experts. You can click on the link in show notes to subscribe.
And of course, stay connected with us on YouTube at Elevate Health Grand Strand and on Instagram and Facebook. You'll find those links in the show notes. We hope you enjoyed today's episode. The information provided in the Elevate podcast and associated materials is for general informational purposes only and is not intended as medical advice. No content should be considered a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or treatment. Reliance on any information provided by Elevate, its host, guest, or contributors is solely at your own risk. We encourage you to consult with a healthcare professional before making any significant changes to your diet, exercise, or wellness routine. Ultimately, your health and well-being are unique to you, and it's important to make informed decisions based on your individual needs.